You've likely heard of type 1 diabetes and type 2 diabetes, but there is another type of diabetes that is being referred to as type 3C diabetes. So, if you want to know more about type 3C diabetes, stay tuned. There is another type of diabetes known as type 3C diabetes, which has had more light shed on it in the last few years. Hi, my name is Wendy, and I am a natural nutrition clinical practitioner, and I'm glad you've joined me here at Nature's Path to Wellness. And of course, you've heard of type 1 diabetes, which is a chronic autoimmune condition in which the body's immune system mistakenly attacks and destroys insulin producing beta cells in the pancreas. As a result, the pancreas produces little to no insulin. And this is a hormone, of course, that is essential to regulating blood glucose levels. Without sufficient insulin, glucose cannot enter the cells to be used for energy and instead builds up in the bloodstream, leading to high blood glucose levels. So, for type 1 diabetes, it often begins in childhood or even in adolescence, but it can really develop at any age. The exact cause, is unknown, although it can involve a combination of genetic predisposition to environment triggers. So often we talk about things, especially nutrition, as something that somebody's predisposed to. So they have the gene markers to maybe develop cancer or type 1 diabetes or different things like that, but it's like a loaded gun. So you may be walking around with this predisposition to a condition, but what actually pulls the trigger is diet and lifestyle. So there's been some indication over the last few years that consuming cow's milk at a very young age may be a factor. So the word isn't final on that one, but it is just something to consider. So the symptoms of type 1 diabetes is frequent urination, polyuria, or extreme thirst, polydipsia, extreme hunger, polyphagia, and unintended weight loss, fatigue and weakness, and blurred vision, along with the susceptibility to infections. Treatment for type 1 diabetes is always involving insulin therapy, pretty much by injections or insulin pumps. This isn't a type of diabetes that can be controlled with diet and lifestyle, although you can improve the conditions of type 1 diabetes. So, just because you have type 1 diabetes or there's somebody that has type 1 diabetes doesn't mean that, hey, they can eat whatever they want because it doesn't really matter. Anyways, they're going to always have to be on insulin. They definitely want to be, of course, having a healthy diet and be concerned about having lots of exercise and that type of thing as well. So, some of the complications of type 1 diabetes can include diabetic ketoacidosis, cardiovascular disease, kidney damage, nerve damage, and of course, vision problems. So, type 1 diabetes is less common. So, when we're talking about the various types of diabetes, like type 1 and type 2, and even some of the other ones, type 3C and type 3 that I've been talking about, it does account type 1 for about 5 to 10% of diabetic cases. So you've probably, of course, heard of type 2 diabetes, which is a metabolic disorder characterized by insulin resistance. And so the body's cells are not responding effectively to insulin. They're not taking up the glucose as they should, or they're so full of glucose because there is so much in the bloodstream. Insulin, of course, is meant to regulate blood sugar or glucose levels. And if the cells are not accepting the glucose, the insulin is ineffective in essence, therefore being called insulin resistance. And it does lead to elevated blood glucose levels over long periods of time and until it is managed properly. And that is what is known as type 2 diabetes. So it usually develops in adulthood. Now, it was usually referred to adult onset diabetes and usually kind of came into play around 45 and older for most people. However, in recent years, and I attribute this to our diet, which is like the North American type diet with lots of processed foods and added sugars, we are seeing type 2 diabetes cases in children. even now. So it's being increasingly diagnosed in children and adolescents over the last several years. The cause of type 2 diabetes is a combination of genetic factors and lifestyle influences. So this still goes back to you may have a predisposition to type 2 diabetes. It may be that people in your family have had type 2 diabetes. And so it may be something that you might develop going on into life. But again, if you are managing diet and lifestyle issues and you're handling those things really well, it doesn't mean that you will necessarily develop type 2 diabetes. So it's like you have the loaded gun, and again, you decide for the most part whether to pull the trigger by having a poor diet and not having any exercise. So obesity or being overweight is a cause. Physical inactivity, so a sedentary lifestyle, poor diet, a diet that's high in processed foods and contains lots of added sugars. And of course, then we have that family history of diabetes. Some of the symptoms of type 2 diabetes, which you may be familiar with, but includes increased thirst and frequent urination, fatigue, blurred vision, slow healing sores, and frequent infections. That one isn't as common, and usually you don't sort of notice that one later into the condition. So if you've had type 2 diabetes for a long period of time and you are not controlling and managing your blood glucose levels, then you may notice that these sores you develop are not healing. Unintended weight loss, surprisingly, can be one of the symptoms of type 2 diabetes, and that's again in a much advanced stage. Darkened skin patches. So you might find that there's like darkened skin patches along the back of the neck or in the folds of the skin. And so just because you have one of these sort of conditions, like you may have some blurred vision or you may be losing weight or these types of things, doesn't necessarily mean that you have type 2 diabetes. But if you have all of those conditions, some of them, two or three of them at a time, and maybe your diet isn't what it should be, it would be definitely worth checking into. What can actually prevent this condition and what the treatment of the condition would be of type 2 diabetes is diet and lifestyle. So increasing your exercise. And this doesn't mean that you have to be going to the gym or running 3 kilometers a day or anything like that. Simply going for walks after the meals that you consume can significantly have like a huge impact on your blood glucose levels after a meal. Having a diet that is full of fiber and just cutting out all of the processed foods and added sugars can have a huge impact on your blood glucose levels and can even, for many people, reverse type 2 diabetes. Medications that are often prescribed, I want to say unfortunately, because it seems like it's the first line of defense a lot of times when you go visit your doctor. And I, in some ways, don't blame doctors a lot because what often happens is people don't actually want to take the steps to reverse type 2 diabetes or even prevent it if they're on the way. Like if there's markers of insulin resistance and their doctors talk to them, a lot of people are like, okay, well, what can I take, right? It would be really great if doctors would learn more about nutrition and, want to educate their patients on how they can manage and even reverse type 2 diabetes. But oftentimes it is controlled by using oral medications. That's the first visit you'll go in. You may have a good doctor who will talk about diet and using nutrition to help, reverse the insulin resistance and talk about increasing your exercise. But most often, and even for myself, my first visit to the doctor included a prescription as I walked out the door for metformin. It can lead to injectable drugs such as insulin. So you'll be given a prescription like metformin, at least initially. And if you're not doing anything to, try and reverse the condition, if you're not actively, managing your diet and your lifestyle, metformin will work for a period of time. The dose will become increased as you go back to the doctors each time. If your A1C markers, your levels are not going down, the dose will be changed and it'll be increased. And at some point, metformin is not going to do anything more for you if you're not doing anything actively to try and help the condition. And eventually, you'll probably be put on insulin. Of course, while you have type 2 diabetes, monitoring your blood glucose levels is going to be super crucial. Complications from type 2 diabetes, poorly managed type 2 diabetes can lead to serious health issues. such as cardiovascular disease, kidney damage, which is known as diabetic nephropathy, nerve damage, which is diabetic neuropathy, eye damage, diabetic retinopathy, or increased risk of infection. So we talked about those sores that aren't healing. And I don't want to get too gruesome about it, but if we're getting to the point where we're so poorly managed with type 2 diabetes and you're having sores that are not healing, we're looking at in the far advanced stages of even amputations. So the distinction of type 2 diabetes from type 1 diabetes is that it is primarily connected to lifestyle and metabolic factors rather than the autoimmune destruction of the pancreatic cells. The onset of type 2 diabetes develops generally gradually, and so it's more a common type of diabetes. So versus type 1 diabetes, it accounts for about 90 to 95% of all diabetic cases. As I've mentioned a couple times before, prevention involves lifestyle changes. So maintaining a healthy weight, exercising regularly, and eating a balanced diet can significantly reduce your risk of ever developing type 2 diabetes, even with a familial predisposition to it. So, and you can even reverse type 2 diabetes, but that's a whole other video. So today we're really specifically talking about type 3C diabetes, which is known as pancreatogenic diabetes. So that's a big word, but it's related it's a form of diabetes that arises due to the damage or dysfunction of the pancreas. So this damage actually impairs the pancreas's ability to produce insulin as well as other hormones and digestive enzymes. It often occurs secondary to pancreatic diseases or conditions that affect the pancreas. And key characteristics of type 3C diabetes develop as a result of pancreatic damage, which may be caused by chronic pancreatitis, pancreatic cancer, pancreatic surgery. So it might be a partial or total removal of the pancreas, cystic fibrosis, or other genetic conditions affecting the pancreas, hemochromatosis, which is an iron overload, or trauma to the pancreas. So if you were in some sort of accident or whatever that damaged the pancreas. And so what happens when you have this type 3C condition is a loss of endocrine function. It leads to reduced or absent insulin production, causing hyperglycemia. So your blood glucose levels are always high. So there'll also be a loss of exocrine function, which is causing insufficient production of digestive enzymes, leading to malabsorption of nutrients. So all of the nutrients that you're taking in with your diet won't be absorbed properly. Some of the symptoms of this labeled 3C diabetes is common symptoms of diabetes. So thirst, frequent urination, and fatigue. Symptoms of pancreatic insufficiency, such as poor digestion and nutrient absorption. Steatorrhea, which is known as fatty stools, weight loss, and abdominal pain. Type 3C is often misdiagnosed as type 2 diabetes because of the similar presentation. So you may go into the doctor's office having a lot of the same symptoms, but often doctors won't look into it a lot further, maybe until it is a lot more advanced. Diagnosis requires identifying underlying pancreatic disease through medical history, imaging studies, and tests for exocrine insufficiency. Treatment for type 3C is insulin therapy to manage blood glucose levels due to reduced insulin production. And so there really isn't a step of going from correcting the diet and exercise or maybe even metformin. We're really moving into insulin therapy right away. This type of condition, the type 3C, I talk about type 2 diabetes being reversible. Type 3C is probably one of those situations where it is not going to be reversible, but you can certainly, like type 1 diabetes, manage the condition a lot with diet and exercise. Something known as PERT, or pancreatic enzyme replacement therapy, to aid digestion and, of course, increase nutrient absorption. The importance of the recognition of this is, so if you're having some of those symptoms that we talked about earlier, and even if you've tried some diet and lifestyle modifications and you're not seeing any improvement, at least immediately. So when I had type 2 diabetes, when I was experiencing problems with blood glucose levels, as soon as I changed my diet, and added a bit of exercise, I mean, there was almost an immediate result, right? So if you're somebody who has insulin resistance or type 2 diabetes, and whether you're on metformin or insulin, but if you're doing diet and lifestyle changes and it is actually effective, then that's probably a good sign that you have type 2. If you are doing all of the things that you should be doing, watching your diet and increasing exercise and not living a sedentary lifestyle, and you've got good sleep patterns and all of that, and there is no improvement, I think at that point it would be a good time to go and talk to your doctor and have him or her investigate a little bit further. And so type 3C diabetes accounts for about 5 to 10% of all different types of diabetic cases, and it is frequently underdiagnosed or misclassified. It is super crucial that you get a proper diagnosis of whatever type of diabetes you have. So whether it be type 2, which is the most common, or if this is a type 3C, because tailored treatment is essential for a good outcome. So if you suspect that you are maybe having some other issues going on, or maybe, type 2 diabetes isn't in fact type 2 and it could be something else, I encourage you to be your own best health advocate and get your doctor to dive into this a little bit deeper. If this video has been helpful for you, I ask you to give it a thumbs up. And if you know somebody who could benefit from the video, do consider sharing it with them. And if you've not already subscribed, do consider subscribing to Nature's Path to Wellness for more health and nutrition information. And I do look forward to seeing you again soon. And until then, stay healthy.